We're live.
Hello and welcome to the COVID313 Community Coalition for Families and Youth. Now going into our 20 plus times of coming to you, Detroit, with facts, with information, with support, and a lot of love, because we know that this continues to be a trying time for all of us in many different ways. But as we do every week, we are delighted to return to you with a focus and information, particularly on our health. And it's so significant to talk about health because this is National Community Health Week. And for many of us all across the nation, we know that if you have your health, you have wealth. And we know in our coalition that knowledge is power. And so we are pleased to be able to bring to you some more voices and experts, particularly from community health, that have been here all the time in the trenches to move our nation forward in terms of our health. We're also going to be talking about our basic needs. And because we know that many of you have concerns relevant to evictions, water, and electricity. So stay tuned for that as well. My name is Jametta Lilly, and I am blessed to be a member of this coalition. I am blessed to serve as the CEO of the Detroit Parent Network. I'm a Detroiter, I'm a Nana, a mom, and I am one of those women from Michigan. So with that, welcome, get set, get comfortable, and now we are so happy to bring to you again, more experts, more expertise, keeping you connected and lots of love in this trying time in COVID. And with me always is our co-moderator, Christine, keeping us connected and sharing the power and the love. Christine.
Hi, Jametta. Hi, everyone. Again, I'm Christine Bell. I'm a mom of 3 really awesome growing children, and I'm honored to serve as the Executive Director of Urban Neighborhood Initiative. I'm also a proud member of this coalition. And as Jametta said, I'm moderating today's town hall. I'll be asking questions, so please make sure you get on the chat or text them to us. We're also translating the town hall to Spanish and Arabic and ASL. So we want to give folks the information they need to get on the right line and get comfortable. Christina, please share the phone number for Spanish translation.
Sí, buenos días. Si necesitas traducción en español, habla al 313-626-7440. Traduciendo el día de hoy está Gloria Rosas y Cristina Ruiz Mazón. Muchísimas gracias. Thank you.
Thank you so much, Christina, and thank you, Gloria, for translating for us today. Saeed, could you please share the phone number for Arabic translation?
إن كنت بحاجة للترجمة إلى اللغة العربية، الرجاء الاتصال على رقم 313-241-7030. الرقم مجددا هو 313-241-7030. معكم سعيد ونجوى دحدح، ونحن مستعدون لخدمتكم. شكرا. Thank you.
Thank you so much, Saeed, for being with us today. And then Julie, could you please share the instructions for ASL? Thank you so much, Julie. And so now we want to make sure that we get all of your comments and questions for all of our panelists. So please chat your comments or questions on Facebook, or you can text them to 313-288-2082. Again, that number is 313-288-2082. We want to remind everybody to speak slowly for our translators, all of our panelists to please speak slowly for our translators, and a reminder to the moderators to do the same. And again, please remember to text your comments or questions onto Facebook or in the numbers that I just gave. And we'll be sure to ask those questions, as many questions, and give as many comments as we can live. I now want to welcome Nkenge She is going to kick us off with her voice, which is always inspiring and informational. Nkenge?
Hi, everyone. I'm Nkenge Browner. I'm the organizing director at Mothering Justice and a mother of 2 school-aged boys. Our back-to-school supply list has always held the usual: papers, pencils, hand sanitizer, hand soap. As many of us switch to homeschooling, this list doesn't change much. The folders, wellness checks, physicians, eye exams, and dental appointments are necessary for our children to thrive. As many of us switch to homeschool, let's remain diligent in our homes around universal precautions. Our homes are not only safe havens for our children, each of us individually make up a family, and those families make up a community. As a community, we can break the chain of COVID. When we first learned of COVID, some of the first places we couldn't utilize other than for emergency uses were doctor's offices and dental offices. These offices worked really hard to be able to respond to us and respond to COVID. They're back open. And just like those folders, pencils, hand sanitizers, doctors, physicians, and wellness checks are essential for our kids. Call your child's pediatrician and ask them how they are sanitizing their offices. Schedule your appointment and maintain your appointment. Call ahead to get an understanding of any check-in procedures that may have changed. For instance, a lot of doctors are asking that you sign in via phone and wait in your car until you're called into the room. Role play with your children at home. Assign someone gloved to be the door captain. Figure out how to maintain these appointments, because it's important that we keep up with our scheduled doctor's appointments and pediatrician visits for our children during this time. This is not the time to skip on health checks, but a time to build a better relationship with your healthcare provider.
Okay, all right.
Stay with us for the next 60 minutes so you can stay informed and powerful. This is also a time to ask experts your questions and have a little fun. To ask your questions, please use the chat on Facebook or text your questions to 313-288-2082. Again, that number is 313-288-2082. We will have question and answer after each segment. If we can't answer a question today, we are committed to getting you the answers by next week. All the questions asked today will be posted with answers on onedetroitpbs.org. For our experts, please remember to speak slowly for our translators. They want to make sure that they are translating the important information that you're sharing correctly. Also, turn off your camera when you are not speaking to ensure our ASL interpreter can be seen, and mute yourself when you are not speaking. Terry Whitfield is our timekeeper. He will chat you your remaining time, and if you go over, gently remind you to wrap up. We'll be taking questions from our audience at the end of the segment. Thank you.
Christine? We just have a pause for a moment. So thank you so much, Nkenge. And as you did, you reminded us how important it is for us to continue to go in for our well child visits in particular. And so it's out of our concern, particularly for our youth and our children, that we are happy to have some of the experts that are joining us. And sorry, for a moment, I'm going to probably call a couple of you out with. So first person I'd like to bring will be Richard Bryce to talk about pediatrics and what we are learning about the impacts of COVID on our children. Dr. Bryce.
Hey, thank you so much. I really appreciate it. I'm representing the Community Health and Social Services Center in Southwest Detroit off of 4th Street in Junction. And just want to kind of give you guys an update of where we're at in terms of COVID, especially related to kids. You know, obviously during March and April, we had, you know, pretty incredible change in terms of our clinic schedules, really decreased our in-visit patient experiences. And so we were only seeing, acute issues or pregnant women. On top of that, we were still seeing kids, but only kids that were 1 year and under. And so at this time, though, fortunately, we've been able to start to open up. Have definitely kind of followed recommendations of keeping things clean and sanitized, and we have protocols that are set up there. And now our secondary goal is, besides getting people back in, especially kids, is giving them the support to make sure that they're getting updated on their vaccines. And so that's been obviously, a challenge when things happen in April and May, but now we're starting to ramp up. Now, one thing that's important for us is this is our Community Health Center Week. And so we're a part of the National Association of Community Health Centers. And so we've done a lot of stuff to make sure that we're emphasizing health within our community as well. And so we do have a few events that are happening. And one of those is happening today, which is related to this idea of getting kids vaccinated. It's kind of a vaccine drive, having people come in, drive in, get kids set up. We also have something this afternoon that's on our Facebook page that's looking at a story time to read to kids, trying to make that same connection in terms of emphasizing good, healthy habits. On top of that, there's a more or less a virtual meeting on our Facebook page as well tomorrow related to understanding good mental health. And then finally, we finish with on Saturday, our virtual Chaz 5K. And so these are some ways that for us, we're just trying to support the community, especially in terms of our youth and pediatric patients, but everybody in general, because obviously it's a very, very tough time. But I still think, besides the fact of the challenges that we face in terms of COVID, we still need to focus on the preventative things and supporting our communities in other ways. So thank you very much.
And thank you. And absolutely, we want to make sure that people know about Chaz and the other federally qualified health clinics that are around our community. Family, we have fought hard for community access to resources in health, and our FQHCs are known for wrapping their arms around our community. So we want you to not only have access to that health, but we also want you to utilize those resources that are there. And to help us better understand and continue to have this lens on particularly pediatrics, we're very pleased to have Dr. Eric McGrath. Dr. McGrath is an associate professor of pediatrics at Wayne State University, and he is an infectious disease specialist. Dr. McGrath, welcome.
Hi, thanks for having me. I just was going to go through some of the myths that have been kind of out there about the infection, and then a case that we had. And I was going to share with you my screen. I'm hoping that I can share it with you. I'm not sure if it's going to work. But
Dr. McGrath, so Cindy will try to bring those up in the background, but I can let you know we're happy to make sure that those slides get to our viewers they can't come up. So I believe Cindy is working on that in the background for you now.
Okay, let me, now it will let me. Okay.
There
So,
you are.
There they are. These are the sort of myths that COVID-19 doesn't infect children, that somehow children are magically immune, that it's a mild infection with symptoms in kids, and that even if a child gets COVID, they don't need to go to the hospital. So these are some of the myths I was going to try to talk about. And the place I still find the best information about COVID-19 is at the CDC website and on the MMWR. They have the most recent information and up-to-date information. And in this particular report, they looked at hospitalization rates in children. And I just first liked how they put a special table in there about common symptoms. So symptoms that kids are having with COVID-19 are fever, but if you look at that, it's only about 54%. So a lot of the patients actually might not even have fever or chills, but the little babies might have poor feeding. Older kids may come in with nausea or vomiting. And then toward the bottom, we also saw a lot of abdominal pain and diarrhea symptoms, which for adults being a primarily respiratory illness, you know, we were surprised in April and May and in late March how many patients were coming in with GI symptoms. And then there are also a lot of children, about a quarter, that had respiratory symptoms and nasal congestion. So those are the more common features we thought we were going to be seeing with COVID-19 cases in pediatrics, but it was kind of surprising how varied it was and how a lot of patients had GI symptoms. The other thing about this report is it showed that there were actually 576 pediatric COVID cases in this broad surveillance system called COVIDnet. And Michigan is represented in the 14 states here, not necessarily the Detroit area, but other counties. Excuse me. And what is a takeaway was that even though the number of kids who needed to be hospitalized was low, like only about 8% compared to adults, where it was 8 out of 100,000 in the population. In adults, it was 164.5 per 100,000 in the population. So kids get admitted at a much less rate to the hospital than adults, but surprisingly, kids were about 1 in 3 who were hospitalized ended up going to the ICU. So that would really fly in the face of the idea that kids can't get sick with this and then it's not severe, because children don't go to the ICU who are not, you know, very critically ill. And then one other graph from that same report just shows the different age breakdowns and how children at the different age groups were hospitalized. Now, children under 2 probably had, for the most part, respiratory illnesses like a respiratory bronchiolitis that we see with RSV and influenza in the wintertime. We were seeing that sort of pattern in little babies and younger kids early on. But then older kids were also getting admitted, but to a less degree overall. And the other thing is that it did show that, the trend was toward increasing hospitalizations over time. So even though, you know, there's this talk about kids not needing it, not being sick, they are actually being admitted at an increased rate overall. And then unfortunately, and what's been in the news a lot, I'm sure many of you have understood or heard about it, was that this does seem to be affecting different ethnicities in different ways. And you can see here from the hospitalized children that a majority, unfortunately, were in the Hispanic and Latino ethnicity or race, if you will, and Black non-Hispanics also had a large case rate. And it's not fully clear right now, you know, this is maybe multifactorial. Many of the Hispanic children that were hospitalized specifically in the report noted that they were more likely to have underlying medical problems. But I think that is yet to be fully understood, but it's clearly been reported in the news, you know, that that African Americans and Hispanics have had a worse trend with this illness overall, unfortunately. And then here's a case that we had at Children's that I'm just gonna go through quickly, and I tried to put it as simply as I can. We had an extremely healthy 17-year-old male come in with fever and abdominal pain, and he had been previously healthy. He was one of the most healthy patients I've ever taken care of. He played 5 different sports in school. He was a like elite athlete, and he came in with just basically fever, some dull generalized headaches, and some rash on his wrists and inner thigh. And then 2 days he had the vomiting and diarrhea. And we were surprised that a patient of his age would be complaining of chest pain. Shocking to us was that he had no upper respiratory symptoms, cough, or any shortness of breath. So he was all pretty much GI and potentially cardiac. And he didn't have much of a past medical history either. When he was younger, he had recurrent ear infections. but he didn't have any other significant medical problems. And the only risk factor for him to be exposed to COVID-19 was that his mother was working in a nursing home and had been to some known COVID-19 exposure risk from some of the patients she took care of there. So he had a fever, a 39.3 Celsius, so that might be unfamiliar. That's probably somewhere in the 101 to 102 range. His heart rate was high. You can see this is the heart rate here. Oops, sorry. And then he was tired and he didn't look too good in general, but he wasn't sick enough initially to go to the ICU. He had a very tender belly. He had a lot of complaints about pain when we pushed on his stomach. And he also had this kind of faint rash on his wrists and his thighs. And we did the basic labs, and you can see here, his infection fighting cells, the white blood cells, were 11.8, which isn't too high, but he did have some immature cells. And then there was a lot of evidence for anybody who can interpret this slide, which I don't want to dwell on it. He had evidence of pretty much profound inflammation going on in the body. But look at his chest X-ray, it was completely normal. So again, being one of our first patients that we took care of with severe COVID-19 that developed over the next 2 days, it was again shocking from everything we had heard, both in the Chinese patients. I have colleagues in China that I was communicating with, and they were mainly, again, seeing respiratory illness. So this was a surprise for us to have a patient with a normal chest X-rays. He had had an abdominal ultrasound, which just showed his liver and spleen were slightly enlarged, but that was non-specific really. And then looking at his hospital course, he developed on the second day of his hospitalization, red eyes. And I tried to put a picture of not him, but a patient with this red eye symptom. And it's kind of like what we would call conjunctivitis, or like a pink eye, if you will. But it spares the area right around the iris, or the colored part of the eye. And that developed on day 2 for him. So we had some thought maybe he has Kawasaki, which is an inflammation syndrome that we see at children sometimes, although it's rare. Because we're a referral center, we see more cases of it. So we started him on treatment for possible Kawasaki. All the while, we were worried about his heart because of his chest pain. So his heart evaluation was continued. And then unfortunately, overnight, he kind of worsened and needed to go to the ICU. There, we found out that within the first day of him being in the hospital, his echo report, or his heart ultrasound report, came back and showed that his coronary artery was dilated. So this was shocking for us because we don't normally see this even with Kawasaki patients until the second week of their illness. And he was coming in with only like 3 days of illness. So we were surprised by that, but we were happy he was on the right treatment because this has been associated with Kawasaki. And then later, again, he tested positive for the COVID-19 PCR, and his inflammation markers continued to rise. And, you know, he was on antibiotics, but unfortunately, he started to need respiratory support on the second day, and he ultimately had to be intubated or put on a breathing machine, the respirator, if you will, and his heart function continued to worsen. And he ended up needing to go on what we call heart and lung bypass, or the ECMO circuit. And that's pretty severely ill. You really can't get much more ill than that. And he, you know, so he was shockingly ill within 3 days of being in the hospital. So I'm just, I don't want to dwell on the clinical issues, but he was very sick for somebody who had been so healthy and such an athlete. He was just critically ill. So we were just, you know, we went on to give him more treatments, and he got the medicine that we give for the antiviral called remdesivir, and he got steroids, and he ultimately did extremely well and actually had reversal of all of the heart changes that we had initially discovered. But he was, he actually, unfortunately, and I'm glad that the previous speaker brought up mental health, because he actually, although he felt better, he developed almost like a post-traumatic stress syndrome due to the fact that, you know, he wasn't expecting to get so ill, and he really was sick. And his admission lasted for 24 days. And I just was, this case just shows you, not to scare you, but that certainly kids do get COVID, and they have what we now know is probably this so-called multi-system inflammation syndrome, or the MIS-C, associated with COVID-19. And I just have one slide on that, but basically, even as we were taking care of this patient, this new inflammation syndrome associated with COVID was being identified in the United Kingdom, or Britain, across the world, actually. So literally the weekend that we were taking care of this patient, the other country, in England, they actually first identified this inflammation syndrome, and we were actually taking care of patients with it around that same time. So it's kind of broadly identified, but certainly this patient met these, what are called clinical criteria for this syndrome. And he was positive for SARS, but we knew even if he wasn't positive, his mom had been exposed to COVID. And so we've taken care of other patients whose COVID-19 tests were negative, but their blood tests either showed that they had antibody to the virus, or both the nasal test and the blood tests were negative, but the patients had these similar features, and they did have, they were living in the areas where there was a high COVID infection rate. So we don't even require that they were positive. We just know that when COVID goes through town, this is a possible thing that we're seeing in some children that we have to keep an eye out for. So I think that's all I really want to share, but I'm happy to talk more about it. But you could tell that the severity of this illness was incredible, and it's truly a myth to say that children are somehow immune from this infection, and that they have mild symptoms. Now, the vast majority of children who get the infection probably do have mild symptoms, or no symptoms at all even. But they do get hospitalized with it. It's not simple. And I would just say that everybody should continue to be vigilant and take those precautions, even that were talked about earlier: washing their hands, wearing the mask, the social distancing, hand sanitizer. All those basic things should definitely be continued to try to prevent the infection.
Dr. McGrath, thank you so much. Your breaking down of this particular case, I think, was very illustrative of that. It's a very complex disease that manifests very differently. And I also appreciate you making the point as a physician. All of you throughout Wayne State, U of M, all are doing due diligence to engage the international community to look at this and understand this is a worldwide pandemic. And to our audience, we're happy now to hear any of your questions. Remember that you can do that through the Facebook chat. Also text us. So do we have any question, Christine, for either Dr. Bryce or Dr. McGrath?
We do. And I just want to remind everybody that there's a survey being put in the chat. And if you fill it out, you'll be entered into a $25 raffle. Okay, so here we go. So what is your recommendation, Dr. McGrath, for parents and guardians regarding children returning to school? We know that the state has a roadmap and we're in phase 4, so schools can go in person or virtually. But what, from your perspective as a physician, what is your recommendation?
We talked about it in our Pediatric Infectious Disease Society. There was a webinar where multiple experts from around the country discussed this sort of broad recommendations. And to take away from that, if the percent positivity of the testing in a local community is more than 5%, that group suggested that it would be suboptimal probably to go back in face-to-face classrooms. Now, that group absolutely, and myself included, believes that in-person schooling is the best for children. And especially for me, I have a child with special needs in learning with dyslexia and dysgraphia. So for him, we are more worried than for my daughter who doesn't have those same issues. For him in the digital learning sessions, he really doesn't do very well. He really needs sort of like carved out specialty type of things. Now, if the percent positivity in the local community is 5% or less, there was still recommendations about if the school chooses to offer face-to-face, that the class sizes be reduced at some capacity to be able to have the children in their desks socially distanced, minimally 3 feet, but optimally 6 feet apart from each other, with a plan in place suggestive of environmental services, being able to clean the rooms, either because some schools were talking about having an A session in the morning and then like a B session in the afternoon, and using the same classroom in the teacher. But the problem is that you have to clearly define how would you clean the classroom in between and things of that nature. Because if you just have them go on the 2 different schedules, but you don't have enhanced cleaning and those kind of practices, you may end up spreading it. Now, another concept about going back to face-to-face is cohorting, which is the same idea that group of kids in the A session is always with the same teacher, and they always stay in that room while they're at school until they go home. And in that case, when they go home, the idea is that they would either be wearing masks or things of that nature, but the masking was a little bit difficult to mandate in the sense that if the schools don't have additional funding and the children's parents can't afford masks, how could we use that? Like, we think that masks and the social distancing would likely be enough if the community spread is a low percentage of positive. But then how do we make sure that every child has a mask or every child has the hand sanitizer at their desk? And these were what people were hopeful for, and maybe your later guest will speak on it, to have those in place for the children. And then finally, the concept was if any additional teachers had to come into the room, that the teacher would come into the room and the other teacher would go out of the room, and the students wouldn't leave the room. In fact, if they had lunch at school in any capacity or snacks, that they would stay in that room and not go to the cafeteria. And so those things were all discussed, but I'm concerned that for most of the school districts, the percent of positive tests is well above 5% in a lot of the communities. And so I don't know offhand right now what it is in Detroit or more globally, like in the state of Michigan, but I don't know, like each individual school district, it sounds like right now is going to make their own decision about what they're going to be offering. But I just plead for them to consider those special needs children as a separate group, because I think that while the digital schooling might work for a lot of children, some of the kids with special needs need a little extra support with this.
Thank you. So I hear from you that being able to ensure that we've got funding for all children to have masks every day and have hand sanitizer at their desks and the social distancing is incredibly important in making sure that when we go back to face-to-face, that kids are safe, and that the infrastructure for schools needs to be there, not only at the local level, but also that the state has to ensure that the money is there for that infrastructure to be put in place. So this is for both Dr. Bryce and Dr. McGrath. Would these doctors send their kids to school in person? And so we heard you, Dr. McGrath, share that for your son, you would really like your son to be in person because of his special needs. And I know that there's many parents on the line that feel the exact same way. So, but would you send your kids back in person right now? And then Dr. Bryce, if you have children.
Yeah, if you want my opinion, if those criteria that I kind of listed, if the 5% positivity could be or less could be there, and those other things could be in place, I think I probably would send them, because like I said, for Gavin, I definitely would. For my daughter, she's fine either way. She, for the social aspects of school, I think would prefer to go to school. But right now we are hearing from our own district that I don't think there's going to be in-person offered at this time. So it was something we, my wife and I had highly considered, but it looks like that's not going to be an option for us right now anyway.
Thank you. And then Dr. Bryce?
Yeah, I was just going to say for myself, I have two young ones. They're not in school yet, but they are in a daycare. That's been a big challenge due to the daycare being closed. But I think following along with what Dr. McGrath said, the having, if the rates are lower, and on top of that, the school is trying to do the best that they can in terms of, making things clean and having a process in place, I think I would feel comfortable. I think one of the big issues that's kind of happening across the country, which is a challenge, is that, and this is even related to other things as well, like do we play college football or something like that, is that people want to open or they want to close. There's a lot of unknowns. And the unfortunate thing is, because of the unknowns of how to deal with it, is that there's really no plan in place that what happens if your school does end up having 20, 30, 40 kids that are positive? How do we deal with that? And I guess the fear is nobody really knows the right way to do it. I think that would also help out in certain districts, that if they had a plan in place to be proactive. And unfortunately, I'm just not hearing that. And I think, unfortunately, a lot of the chatter is out there. But I think in Michigan and Detroit, I think the rates are low enough. I would probably feel comfortable, but I can understand the argument the other way of where schools may not want to open as well, due to the safety and the fear of what could possibly happen.
Thank you. And so there's two more questions that I'm gonna ask you guys to be, both of you to be brief. But I want, so a person has said, when are they gonna stop making people afraid of COVID and teach people how to live with it? So Dr. McGrath, could you share one thing that every parent and person should know of how we live with COVID?
Yeah, I mean,
and then Dr. Bryce, I'm going to ask you to share your one thing.
I think that in living with it, the concept of living with it is like adjusting for it. For instance, if you want to eat outside or eat at a restaurant, let's say if you don't want to cook, as an example, you want to go to a restaurant, consider picking a restaurant that has outdoor options where the sun, the UV light might help you have less risk of having it infect you in a sense than eating indoors. That's like kind of a simple thing that you could do, at least for now in Michigan, where I feel like the risk would be mitigated and low, as long as, you know, people were washing their hands and the wait staff and the managers were trained on proper cleaning techniques.
Great, thank you. And then Dr. Bryce?
Yeah, I would echo what Dr. McGrath said. I think from something that's important is that what we also know, and we see this at Chaz as we do, drive-up testing. It seems like there's a lot of diverse reactions to COVID. So there are some people that have it and have no symptoms. There's no detriment to their health in any way. And then unfortunately, we've also had patients that have passed away related to COVID. And so you can imagine there's a wide variety of how people react. I think the thing that we emphasize to our patients, besides those same things that Dr. McGrath said of, hey, no matter how you're reacting, washing hands, wearing your mask, socially distancing, very important. And then probably the other thing that's just as important is being able to recognize if those symptoms are becoming an issue that you need to access further care, and whether you would need to go to your clinic or talk to your physician or your provider and or go to the hospital. And those are the things that we're trying to emphasize to our patient population. And those things would be, hey, of course, if you are getting short of breath, or really short of breath that you need to go get help right away, uncontrollable fevers, feeling very, very sick. These are things, once you get to those points, would be reasons that you need to access further care in a rapid way.
And I would just add on to that briefly. I know you want me to be quick, but if you're having GI symptoms and fever, I mean, vomiting
I'm
and
sorry, Dr. McGrath, GI?
I'm sorry, yeah, vomiting or diarrhea symptoms.
Yeah.
And you're basically not able to stay hydrated with it, or in that setting with the fever, if you begin to have any type of chest pain at all, I would definitely go straight to the hospital. And now there's been enough of those cases that most of the emergency departments that do take care of kids have a protocol for how to handle those cases that are now called MISC. They've had a lot of names initially as we tried to further understand it, but they have protocols in place to fully work those patients up rapidly so that people don't get missed.
Thank you so much. I know Jametta popping on means that time is up. So we have a couple of questions about vaccine and second wave. We're going to send those to you and so that you can answer them for us. Thank you both so much. This was really helpful.
Really helpful, and we appreciate you talking about vaccines so much, talking about our children with special health care and other special needs and what's happening in education. And we're going to have a greater focus on that family in our week next week and to come, because we recognize that Detroit in particular has a significant population of children and families challenged by special needs, and districts planning around that, as well as the districts will be sharing how they are in fact responding to and specifically for these kind of contingencies that Dr. McGrath as well as Dr. Bryce have spoken to. So please still send your questions. We will make sure that those have an answer, if not this week, by next week. So we're going to transition in our program from talking about all these critical issues around health. We know we want to understand these concepts like phases. We're hearing different language from the state, and we're really pleased to have from Governor Whitmer's office, Brandy Johnson, and she is a policy advisor for education and workforce development. Brandy, welcome.
Thanks for having me. So the question is, what are the differences in phases as it relates to the My Safe Schools roadmap?
Yes.
Great.
Perhaps the difference in phases and what each of those might look like that an everyday person could well understand.
Sure. So on June 30th, the governor released the My Safe Schools roadmap, as well as Executive Order 2020-142 that outlined the different phases as it relates to schools for the 2020-2021 school year. We opted to align the My Safe Schools roadmap to the My Safe Start plan, which is the reopening plan. That reopening plan of the economy, again, we're using the same phases. In that plan, there are 6 phases. And with phase 6 being post-pandemic, meaning we have a widely available vaccine or treatment, and that, this pandemic phase is behind us. So before phase 6 and phases 1 through 5, it's pretty simple. If we are as a state, or if any region within the state is in phases 1, 2, or 3, schools are closed for in-person instruction. In other words, we would shift to a posture of what it looked like in the spring, where school buildings were closed for classes. All students did remote or virtual instruction. Learning was still happening for certain teachers were still teaching, and students were still learning to the greatest extent possible, but school buildings were not utilized. Currently, as of today, and there's no imminent changes being planned, no region in Michigan is in phase 3. In phase 4, that is when schools may be open for in-person instruction with very strict health and safety protocols in place. Those strict health and safety protocols are outlined in the My Safe Schools roadmap. but they include requirements around wearing facial coverings, around hand hygiene, around things like cleaning and disinfectant, rules as it relates to transportation or school buses, etc. Minimally, schools would have to require and implement all of those health and safety protocols that are required in the roadmap, although they are welcomed and encouraged to go much farther than the minimum requirements in the roadmap. In phase 5, and for context, the vast majority of the state, including the Metro Detroit area, is currently in phase 4. In phase 5, some of those restrictions are loosened. Schools are given guidance and strong recommendations about what they should implement from a health and safety perspective, but ultimately the plan is created by each individual school or school district with input from teachers and parents and adopted by the school board. The requirement is, and the Upper Peninsula and the Traverse City area are currently in phase 5. As we speak, school districts are finalizing and adopting their plans. Their plans are due in 2 days on August 15th. They're actually needing to submit those 3 plans. They'll need to submit a plan for what it will look like at that school if we are in phases 1 through 3. It will be a plan for what school will look like in phase 4 and a plan for what school will look like in phase 5. Those plans have to be adopted by the school board and submitted to the state of Michigan. In terms of the differences between phases, so in phases 1, 2, and 3, there is just clear growth and spread of the virus in a way that is a bit more uncontrolled. That was really what we went through in the spring. Since then, we've largely flattened the curve, with UP and Northern Michigan being able to go into phase 5, the rest of the state being pretty stable around phase, at phase 4. In phase 4, I can share with you some of the things that the public health metrics that we look at in terms of virus status. So the number of new cases and deaths are continuing to fall from our peak, even if case levels are still high. If there are outbreaks, they are able to be quickly identified, traced, and contained due to testing infrastructure and rapid contact tracing. The health system capacity can handle outbreaks, and therefore there isn't fatality rates associated with COVID that are abnormally high due to lack of hospital capacity. And the overall number of infected individuals still indicates the need for these mitigation strategies like wearing facial coverings and distancing to stop transmission. In phase 5, we would see improvements in those metrics. We'd still be continuing to see new cases and deaths are continuing to decrease for a period of time. The number of active cases have reached a point where infection from other members within the community is less common. There's still widespread testing so that positivity rates are much lower than they were, say, when we were in phases 1 through 3. And there's, again, that infrastructure around contact tracing, case investigation, and containment strategies so that the virus, that new cases of the virus are continuing to fall. I'll stop there.
Thank you so much. And in particular, breaking down that difference between phase 3, phase 4 versus phase 5. And I certainly can let the audience know that the Detroit Public School Community District, as well as charters, as a result of the leadership at the state level and their own leadership, from Superintendent Rice down to Dr. Vitti and others, have a reopening plan. And we encourage all of you to go to your website for your particular schools or school district, and you will see that reopening plan. And it's important for you to know that so you can have some comfort around what is occurring, or if you have questions that you can speak to someone. And just lastly to add, thank you so much, Brandy, again, for the leadership of our governor and Dr. Khaldun, that we know that education and health are working hand in hand to make sure that Michiganders are safe. Thank you so much again. Do we have any questions, Christine, that have popped up before we move to our next speaker?
Yeah, so there's just one. Brandy, are there any visual aids to understand the phases? So is there a one pager or something along those lines that we can share with our audience that has the phases?
For the purposes of school or for the purposes of just in general the phases?
I think the question that we're getting is, are there no visuals for this? I never understand the phases. So I think anything would be great. Any sort of visual would be great.
Yep, I will put some links to some more visual, for some more visuals in the chat.
Awesome.
Perfect.
Thank you so much, Brandy, and thanks for being here today. That's it, Jametta.
Yes, okay, great. We're going to move forward in our discussion, and it's important that while we talk about health, we talk about education, we also know that there are basic needs, and whether it's housing, whether it's electricity and water, we need to know what the resources are at this extraordinary point in time. And we know that the health disparities are adversely impacting, in particular, African-American, brown, and low-income communities in the city of Detroit and all over the nation. And so to help us kind of understand what in particular the opportunities that DTE is providing, we are happy to welcome back Marifa Kaleha, and she is going to speak to us, as well as Cheryl Stafford, who's part of the program for energy assistance with DTE. Welcome, ladies.
Thank you very much, Jametta. It's lovely seeing you again.
Yes.
So again, thank you for having DTE today. And we are here just to invite the community to please call us at our phone number, which is 1-800-477-4747, because we have a lot of resources available to help the community. So we understand that every household has a different situation, and this is why we're here to invite you to call and to remind you of these fantastic programs that are the most commonly used with different people in the community. And with us today, as you mentioned, is Cheryl, who is going to help us cover the 5 most common energy assistance programs and payment plans that we have. Thank you so much.
Good afternoon, everyone. My name is Cheryl Stafford, and I work in our community outreach group. And I would like to talk about the 5 main programs that are actually going on right now to help your customers get assistance. So if we can turn to the next slide. I'm going to start with the SER because in October 2019, the SER became the starting point to receive assistance for the majority of the funding that's released in the state of Michigan. When COVID started, there's a lot of changes that happened with the SER, and there's some things that's been relieved. But just so you know, a customer has to be 150% below the federal poverty guidelines. As long as they have some arrears and assets less than $15,000, they qualify to go and get an SER. The SER payments, you can get up to $1,150 towards your gas and $1,150 towards your electric. Initially, when they started in October with their new fiscal year, they were saying, hey, if a customer comes once, the customer cannot come back. That process has changed. If the customer has already received some funding from the SER, please send them back to get the remaining amount. So if they got $500 in November, because that's what they owe, they can go back and get another $650 towards gas. And if they got $850 towards electric at that time, they can go back and get the remaining $300 towards the electric. So we need them to actually apply for those SER. At the time they apply, they can do it online. They can contact DTE Energy. We're actually doing the SER. We have navigators by calling the 1-800-477 number. And after they get past our first two prompts talking about a gas leak or a down wire, tell them to press 6, and then they will be prompted into the process so that they can have someone help them complete the SER. The other thing with the SER is they actually, since April, the state decided to waive the annual fee amount. So they would tell you, you need to pay X amount of dollars to get the LSP, is the shortfall amount. They don't have to pay that. But what I really want customers to know, if you already got an SER, please go back and get the difference. If you hadn't got the SER, the only way they'll know if they qualify if they go through the process and try to fill it out. There's plenty of places they can call. They can call 211 if they don't want to go through DTE, or again, they can call DTE to get that information.
Cheryl,
Yes.
You're sharing really important information. And so our translators have just asked if you could please just slow down a little bit so that they're able to translate the information properly. So
I got you.
Could you just slow? Yeah. Okay. Thanks,
Yes.
Cheryl. This is really
No
good
problem.
information. Thank you.
Okay. The next program that's out there. So I am going to reiterate, it's over $23 million available in funding between the SER, money for getting on LSP program, the home heating credit, and the money that the agencies have. Now I'm gonna go to the LSP program. For years, people said, let's go, go back, yep, stay right there. They said, let's get a payment plan in place so customers can afford to pay. This is it for now. Customers are put on a specific budget depending on their income and depending on whether they have combined account or just gas or electric. The income guidelines is 150% of the federal poverty guidelines. They have to be qualified through an SER. Qualified meaning they got the paper back and it says, yes, we'll pay this towards your electric or this towards your gas, or you have a copay. If you have a copay, please contact our LSP agency, because that is not a denial. It's just saying that you have a copay. Both of those are steps towards going on LSP. The other thing with LSP is you do have to have, you can't exceed using $3,750 a year. And if you have arrears, we need to change this because they just upped the arrears limit to $3,000. So we'll get that fixed. The arrears limit is up to $3,000. Both of these that I just spoke about, these changes in these rules and the guidelines, expires September 30th. So we got to push fast to get in there, because come October 1st, we don't know what the new rules are, but these are the rules that goes with the funding that's available. And if we don't get it to the customers and everybody lose, because it just goes away. The other thing with LSP, the maximum amount for a combined customer gas and electric is $130. And as long as that customer pays that each month, we get paid 1/24 towards their arrears and a portion that helps offset their budget. In 2 years, they should be paid up, and they pay that month for 2 years. They also have one-time assistance. So some customers don't qualify because they're over on that consumption usage. They can get one-time assistance towards their bills, and then they can roll on one of DTE's other payment plans. The home heating credit. This is another funding through the federal government that every year money goes back to the state. Anybody that's 110% of federal poverty guideline, if I have heat in my name at the time I file, or my heat is included in my rent, they should be applying for the home heating credit. It takes the Treasury about 4 to 6 weeks to process. Accounting Aid Society is really helping us push this and help customers get this filed this year. They can see another tax preparer, and I know different counties have different agencies to help customers that are low income file for this. They just need to make sure they can file for it, and they can receive up to $1,000. It's based on your income, number of people in your household, and what your usage was for the previous year. And then DTE decided during COVID, we have what we call a personal service protection program. I'll hit on that in a few more, but I just want you to know it varies by the customer. That's why it's called personal, and the income varies. So if you're above the 150% and you can't get anything else, they need to call us right away so we can find out what their needs are. And then the representatives will work with them to come up with a payment plan. And then our other payment plan is shut off protection, and it's been in place for several years. We put customers on there for our seniors and our low income customers so that they will not be shut off throughout the year. Next slide. One thing about the MDHS started, they have navigators that anybody can become a navigator that goes through their process, get the training, or I should say anybody, but most people. And they're pushing for people to help become navigators to help complete the SER. Because the more people that help complete the SER, that's the faster the reps at MDHS can take that application, review it, and see what help the customer needs. Customer can also complete this on their own. So we have a lot of savvy young folks and savvy old folks that can actually just go to the new My Bridges link that's listed on here, and they can complete the SER for themselves. They do not need a shutoff notice. They just need to have pass-through amount. And this is available from October the 1st through September 30th. Next slide. And this is just trying to explaining some of the access that they have to be either a navigator, referral, or access partners. Before COVID, they did have access partners that provided computers and laptops to agencies, churches, hospital, whoever wanted to be a partner. And then they have ones that just does referral. They send referrals to the customers. They receive referral from customers and using My Bridges and try to be that referral process in between. And the navigator is that one-on-one. I walk through the entire process, which I help you get this SER completed in the system. The agencies with MEEP funding that do LSP, they take it another step further. And the two links are listed. You can be a MDHS community partner, or if people just want to use the portal themselves, the portal is listed. Next slide. I went through the changes that the state has put in place for COVID-19. They do not have phone interviews anymore. They used to have to call in and have phone interviews. They got rid of that. I talked about suspending the one time a year that you can get the amount, any amount, but they've moved that out the way so they can go back and get up to the $1,150. The asset used to be $5,000 that a person could have. They moved it up to $15,000. And then they eliminate the shortfall determination, which is where they had a chart that says based on how many people household, you should pay this much a month for electric and this much for gas. Next slide. This is a list of our LSP agencies that have access to the MEEP funding. So if you have anybody that received the SER since October, they're trying to get on LSP, they have a copay, they should be referred to one of these agencies to go on LSP. Next slide. We also have an income verification process because everybody's income, everybody doesn't get assistance. For DTE, you're low income if you go up to 200% of the federal poverty guideline, most assistance 150%. But with us, that allows a customer to get on a low, payment plan. That's different than if they're not low income. And we go through and we just verify if you are receiving state assistance, they're coded. We code those automatically in our system so that we'll know when a customer come in, if they get the home heating credit draft, is another one. Next page. This page just explains what proof is needed. I'm not going to go through all of them because I know time is of essence, but we do have a place where they send the information to, and I think that's on the next slide. Nope, go back one slide. It's not. If they go to our website and they go under our assistance page, there's actually a link that will walk them through exactly what they need to do. They can upload the information right there, and then it will go into a group who will verify if they're low income or not, and then they will contact the customers and let them know. Oh, and the link's at the bottom, I'm sorry. Next page. The next two slides just talk about, and it gets into details, a little more details about our personalized service protection plan, because one is based on if you're 0 to 30 days in arrear, or if we have some customers already on a payment plan, but I lost my job and I can't pay this just yet. And then we have customers that's over 30 days. Now it's not even on a payment plan, but they owe us money. And if they're low income and seniors, oops, go back one right quick. If they're low income seniors, this slide talks about some of the plan length and the things that they qualify. You can go now to the next one. And this page is just for customers that are not low income. And our low income, again, is based on 200% of the federal poverty guideline. So if you got unemployment verification, or you said you had COVID, this slide talks about some of the plan length, the down payment, and the details. Still, you have to call us because these are personalized to each person that calls in. Next slide. If someone's unemployed, we have an email that's called COVID Help, and we just ask that they use that email address. They send in their first and last name, the address, phone number, and then we should get back with the customer anywhere from 48 to 72 business hours. And then those that are quarantined, we have been giving them a 30-day hold because we understand that, if you're quarantined, you can't work, you can't get out the house, and you may not be able to get a way to provide us the documentation. Again, customers have to call DTE. Next slide. This one just kind of goes through our restoration process. So yes, DTE, it's going to start back, and we have started back like in customers, but we do want to make a way for customers to contact us. One of the things is some people don't move until they get the shut-off notice, so they don't move until we literally turn the service off. And we've seen that over the last few months because people are not going for funding. They're not going to get help. They're not calling in to DTE. And we're trying to prevent that process from turning off service because we don't want anybody's service turned off. But if it so happens, if that does happen, this page talk about the Restore for Low Income and Seniors and how we will waive the deposit and reconnect fees and the down payments and the length of payment plans that we offer. Next slide. And this slide is again for our non-low income customers if they're disconnected and what we would do for them. All right, next slide. The other thing that we do have a payment plan out there that's available to nonprofit organizations, small businesses, but you have to call a phone number, which is different than the 1-800 number. It is 877-337-3905. And someone will assist you with a payment plan if you're a nonprofit or you're a small business. Next slide. And these are some of the frequently asked questions that we have. How can tenants apply for SCR? They have to call the 1-800 number. And then they can reach out to one of our partner agencies and complete the SCR. So if they have a past due balance and they moved into a place and they need to get that service in their name, they need to contact us. And at the same time, they need to reach out for assistance if they meet the qualifications. And does DTE honor Detroit's ID? Yes, Detroit City of Detroit ID is considered a valid ID at DTE. And then we have May undocumented clients apply for SER? While undocumented person are not eligible, they may apply for assistance. It will be prorated based on the eligible person in the household. So they just need to make sure they provide social security number as well as verification document for qualified aliens in each member of the household. Next slide. And this just explains what a qualified alien includes from the state of Michigan. You can go through this list. Next slide. And that is it for me. Marifer, back to you.
Thank you so much, Cheryl. I think that Christine will take it from here.
I will. Thank you, Marifer. So there's a couple of questions here. Some we're going to send to you, but there was a question that I didn't hear answered. Can people who aren't behind but need help get some assistance?
Can people who
aren't behind, so they haven't let their account go in arrears, but they still need assistance because a life event, like they lost their job because of COVID, or they've prioritized paying the DTE bill and really need to pay another bill. Can somebody in that situation get help? So they're up to date, but they need assistance.
So no, unfortunately, our programs are all geared towards arrears. You fall that first month behind, then they can. The only thing out there that people can actually get and do not have arrears is home heating credit. But home heating credit is based on your taxes from last year. So, if last year you wasn't 110% or fell to poverty guidelines, you won't qualify. But if you were, and you're paying consistently, yes, you do qualify to file for that home heating credit, even though you owe us no money.
And the home heating credit, is that for renters and for homeowners?
Yes. Well, it's just for, you mean homeowners as I own my home and accounts in my name?
Yes. What about those who own their home? Some are right at the income guideline for home heating credit and they do not get approved.
So because it's based on your taxes,
right,
it has to be that 110%. So whatever happens when they file, it has to be the 110%. But yes, if you own your home and the service is in your name and you're at, you meet that 110% file. And if you're renting, that's the other thing. A lot of people don't do it because they're renting and they're like, hey, I pay my landlord. True enough, the process is different. Whereas if you pay a utility company, then you get the energy draft. If you pay your landlord, they send them a check and the amounts are different.
Okay, great. Thank you so much, Cheryl and Marifer. Jametta?
You're welcome.
Yes, thank you. And in particular, we're so pleased that you provided the slides. So to our listening audience and our viewership, please know that you can get this information. Marifer and Cheryl, we thank you so much because the community needs this. I think you said something was interesting, and that is that people often wait till they are losing their utilities before they call. So we know this is an extremely stressful time period for families, parents, and parents who are looking after their parents and their children. So we appreciate you advocating for the community. Extraordinary time period, and we need to be able to give grace to all of us. And speaking of parents and the parent voice, to remind us that we can be strong in this moment, we're really one of our folks from Hope Starts Here to join us with that parent voice. Welcome. Michelle May, there she is. Welcome, Michelle.
Hello, my name is Michelle May, and I work with Hope Starts Here. I'm a parent advocate, community outreach specialist. Excuse me, I'm nervous. And so we are encouraging our 60 days. We are encouraging the parents to encourage their children, encouraging them that helps them motivate them every day, and especially when they're achieving new goals and learning to walk and eating vegetables and taking exams. We're encouraging parents to hug your child, at least scientifically. Hugs are given 60 seconds, but 20 to 60 seconds. I give them for 60 seconds. You can help every child grow smarter and healthier and happier, more resilient and closer to the parent. Number 3 is talk. When riding in the car or bus, spending time about when you see and tell your child a story. When your baby talks and smiles, and sounds, listen to sounds, answer and repeat back what you hear. Talking to them is very important. Singing, when you're holding and hugging your child, you use a familiar tune and sing to them about what you're going to be doing next, like going outside, seeing all the bugs, cooking, etc. 5 is reading. Read street signs, labels on food you eat, names on the stories you walk by, any and everything you see, read to your babies. Number 6 is play. Do actions and try to get your child to copy you. Clap your hands, pat your head, tilt your head from side to side. Encourage them to clap their hands. We encourage your child to be as happy as possible, because it's a lot of children out here that doesn't have that kind of love, and they need that kind of support to get them through the day. And it has helped my family as well, coming into this company, Champions for Hope. I enjoy it. It's fun, and it's helping me be a better parent. And it's helping me encourage other parents to do the same thing that we already been doing. Loving on your child, hugging on your children, your grandchildren, your nieces, your nephews, if you don't have any children. Love on each and every child you see, because it's very important, because some children don't get the love and they don't do well at school. They don't do well as an adult if they don't get these things while they're young. So it's very, very important.
Michelle, thank you so much for reinforcing the importance of love. And so with that, we really appreciate you sharing that and how it's made a difference for you as a parent. And I think all of us are kind of beaming at your authentic voice. So thank you. Yes, I hear you.
Oh, shoot.
You might want to go ahead and hit mute, but it's all good. Don't worry about it. I'm kicking it to Christine to close us out. Thank you so much, Michelle.
Thanks, Jametta, and thank you, Michelle, for reminding us, even in these stressful times, to make sure that you are showing sweetness and love to your children daily. So it's time to wrap up our town hall. We want to thank all of our panelists and thank each of you for joining us today. Again, if your question wasn't answered, we'll get the answers and post them next week on onedetroitpbs.org and on DPTV Facebook. If you want regular updates, please chat your email or phone number in the Facebook chat right now, or you can text it to us at 313-288-2082. Again, the number is 313-288-2082. We're trying to make these programs shorter, so we're a little over today, but in general, we're keeping them down to an hour and 15 minutes. We want to make sure that we're being respectful of families' time, as well as get you the best information that we can in a shorter period of time. We have a few asks, like always. First, the census deadline is fast approaching. It is September 30th. So the new deadline for the census is September 30th. The census should take you 15 minutes to fill out, and everyone in the United States can fill out their census. regardless of documentation or no documentation, every person can fill it out. And we need every person to fill it out. This is how many decisions are made around our representation in Washington, D.C., but also how much money we get for Head Start and breakfast programs and lunch programs and schools. It is incredibly important to fill it out. And those 10 minutes will make sure we have what we need for 10 years. Please fill out your census. Second, November is right around the corner as well. If you didn't have a chance to register to vote for the primary, you can register now. You can register online, or you can register in person, but we're asking everybody to register to vote. We also will have additional people coming in onto our town halls talking with us about the new voting laws and how we make sure that our voices are heard. So if you haven't already, register to vote. Lastly, we are putting a parent survey in the chat right now. This is a survey that a citywide coalition has put together. It'll take about 10 minutes or so, but it'll help us in the city know what kind of resources, coordination, and collaboration we need to put together to make sure that our families and our young people have the things that they need to thrive during this time. Lastly, those are the asks, and we really do want to hear from you about what you want to know about, and therefore what we share on the town hall. So if you have topics or experts that you want to hear from, please share them in the chat now or text us at 313-288-2082. We're putting the survey in the chat one last time. You'll be registered for a $25 gift card. And like always, I'd love everybody to turn on their cameras because this town hall is truly a group effort. And I'd like to remind everyone to stay healthy, stay powerful, and stay strong. Cindy, can you say that in Spanish, please?
Manténganse fuertes, manténganse saludables y manténganse bendecidos.
Thank you, Cindy. Saeed, can you say that in Arabic, please?
حافظ على صحتك، ابقى ثابتا ومتينا وابقى قويا. إلى اللقاء. Thank you.
Thank you, Saeed. Everyone have an awesome rest of the day.